Hi, so my name's Ignatius. I'm a former UNSW student. I did a mathematics and finance degree here. That was about more than 15 years ago, actually. So I majored in statistics and finance, but during my time here, I also studied a couple of actual studies subjects, and I found that I really enjoyed that. And as a result, after my graduation, I pursued a career as an actuary. So that's my background. What drew me to actuarial studies is the ability to combine quantitative skills with solving social problems, economic problems that are very tangible. So if you think about helping manage the risk of not being able to pay for your healthcare needs, there's a mathematical solution to that, which is pulling people's risk together in order to make the cost a little easier for everyone. So I think the combination of being able to apply your mathematical skills to a social problem like that is what drew me to actuarial studies. Yeah, so in my day-to-day work as a health actuary, I help my clients to solve a whole range of problems in the health sector. In the health sector, we have different types of stakeholders. So you have payers who pay and fund for the healthcare. You also have providers who are the ones providing the medical services. So, for example, the hospitals and the doctors. And so my focus is really on the payers. How do they go about funding healthcare? So within that payer space, you have health insurers and governments and a range of different, different players. And so within that payer spectrum, I focus mainly on health insurance companies. And so the type of things that I'm helping them with are, for example, helping them think about the risks of different health insurance products that they may be thinking about introducing into the market, what kind of premiums that they should be setting, what's the risk profile that they are likely to attract, and other implications such as how much capital do they need to allow for in order to support that product. So a whole range of kind of actuarial, I suppose, issues to help health insurers be able to provide this kind of financial risk management product for the market. So the type of companies that hire actuaries in the health space range from your consultancies. So, for example, the Big Four, one of which is the one that I work for, through to more boutique consultancies that do focus mainly on health. Then outside of the consultancy space, you have the direct insurers, so insurers that employ health actuaries directly, so they have them in the company. So these would be, for example, insurers like Medibank, Bupa, NIB, HCF, just to name a couple of the big ones that operate in Australia. And then I guess one of the interesting areas that health actuaries are increasingly entering into is broader health. So this is, for example, outside of the health insurance traditional space, you have health actuaries helping governments to understand, specific health policies, health financing policies, the implications around that for the health insurance industry. You also have health actuaries helping understand, helping understand drivers of health. So data analytics is very useful in that space. And you also have health actuaries now working in new types of insurance. And the most prominent example that comes to mind is the National Disability Insurance Scheme. So there's a very growing team of actuaries that are working for that organisation. So you can see that health actuaries work in a wide variety of areas that touch on people's healthcare needs, whether it's with a direct health insurer, whether it's in a consultancy like myself to support all of those different players in the market, or in a government role, or in a new exciting scheme like the National Disability Insurance Scheme. So there's a lot of challenges in the health insurance space at the moment. At the moment, the government is doing a review of the industry, and that's been driven by there's a lot of consumer misunderstanding, I suppose, of what health insurance covers. So knowledge and understanding of products is not the best. And so there's a question that government is trying to answer as to whether products can be simplified, whether there's ways of making health insurance products easier for consumers to understand, whether there are other ways of teaching the public about health insurance so that they are making informed decisions. Coupled with that are issues around, well, what is the product, the minimum kind of level of product that, health insurance should be offering, and whether or not government should provide, should be, I suppose, interfering in the market and actually setting, rules around, minimum levels of coverage. So currently there are rules around what can be covered, what needs to be covered by private health insurance, and I suppose it's an ongoing question as to whether that level is set appropriately, and whether it's keeping up with the needs of the public. So those are some of the challenges that are that the market is seeing at the moment. And in terms of future challenges, I think this is one that is ongoing, both currently and into the future, and that's around sustainability. So how do we keep health insurance affordable? How do we keep health care affordable and accessible to the community? And that there's a trade-off there between providing more and more health services versus the cost. So someone ultimately has to pay for that, whether that is through high health insurance premiums or higher taxes that the government, has to charge in order to pay for all of its different expenditure needs. If we think about some of the emerging technologies that are available, so I touched on data analytics before, and big data is really something that I think will make a big difference to the health space. If you think about all the wearable technology that people have these days, there is a huge amount of data that is available to help people, to help insurers, to help government, health providers understand how to incentivize people to adopt healthy behaviours, what are the factors that may be an early warning indicator that someone may be in need of hospital care or any other kind of medical care, whether they are more predisposed to certain type of medical conditions. So big data is really something that I think is going to be increasingly important in this space. And so how do existing providers react to that and take advantage of that? If you think about health insurers, they're really trying to encourage the members to adopt healthy behaviours. One of the challenges, I suppose, with the way that the industry is regulated is that the financial benefits of trying to improve their members' health isn't always necessarily a direct direct result of their activity. So to explain that, I kind of have to go into a bit about the health insurance regulations. For example, the fact that there's community rating, which means that all people pay the same premium for the health insurance product, regardless of the age or any other kind of rating. So there's no risk rating allowed. So for those reasons, it's difficult for health insurers to realize some of the financial benefits of introducing wellness programs or broader health programs that improve the health of their membership. So that's one of the challenges, I think, that health insurers face in that area. If you think about the government, they are also trying to manage the demand on health services that they are funding, whether that is in a hospital or people going to GPs or using other medical services or medical devices that they also fund quite substantially. So again, they would like to encourage members of the public to adopt healthier behaviours, exercise more regularly, eat better, and the data, that we are increasingly have at our disposal, you would think that logically there would be something there that they can use, and but again, there's privacy issues. There's how do you prove that certain characteristics or certain programs are explaining the behaviours that they are seeing. So making that business case is tricky. So, but I think as we come to grips with the data that is available and how to use that, I think it will increasingly become a lot more embedded in the way that we manage healthcare in this country. And in fact, we see that already in other countries as well as obviously here. Yeah, so the advice that I would give to actuarial students today is to remind yourself what it was that drew you to actuarial studies. So ultimately, I think the actuarial field is one around financial risk management and applying those tools that we learn, the mathematical tools, to a broad range of different types of risks, whether that is solved through life insurance or general insurance or health insurance or superannuation. It's really coming back to the core of what being an actuary is about, which is managing financial risk. So my advice to students is to think about what area that you would like to play and where your passion is, and always have a curious mind about how things work, whether things can be done better, not to accept that the status quo is the best way of doing things, and constantly learn about whatever it is that you are passionate about, and make a contribution to that area. I think actuaries have a role to be a disinterested voice. So by that I mean to be objective in providing advice and having a voice in areas of public policy, whether that is in retirement or health or whatever. I think these are areas that actuaries have a role to play in. And so my advice is to find that passion, to contribute, and to be constantly learning.